Hello everyone, myself R. Arul Kumar, Assistant Professor, Department of Pharmaceutics, Sri Shanmugha College of Pharmacy. So today we are going to see about posology. Okay, in posology, a fundamental concept of posology in pharmacy. Okay, to understand the science of a drug for safe and effective therapeutic outcome. Okay, so first, we need to know what is posology. The posology is the scientific branch of pharmacology dedication to determining precise dosage of medicinal drugs. Okay, it focuses on establishing the appropriate quantity of medication required to achieve optimal therapeutic effects while minimizing the risk of adverse reaction or toxicity. Okay, the posology is also the terms um, mm, derives from Greek word posos, which means how much. Okay, and logos means study of. Okay, so the posology means we need to determine the precise dosage of medicinal drugs. Okay, medicinal drugs. Okay, reflecting its core purpose, the systematic study of quantities and their administration. Okay, so why posologies matter? Yeah, accurate dosing is the cornerstone of successful pharmaceutical care, bridging the gap between pharmacological knowledge and a clinical application. Okay, so self-assurance and therapeutic efficacy, personalized care is the critical importance of posology. So it prevents the self-assurance means it prevents the harmful overdosing and ensure patient protection from toxic effects. And therapeutic efficacy guarantees adequate drug levels to achieve desired clinical outcomes. Same like personalized care means enables tailored treatment considering individual patient and characteristics medical conditions. Okay. Factors influencing drug dosage. So, multiple physiological and clinical parameters must be carefully evaluated when determining appropriate medication doses. Understanding these factors is essential for safe pharmaceutical practices. So, what are the factors? It's age, body weight, genetic factors, organ function, special population, drug interaction. So pediatric, adult, geriatric patients require different doses strategies due to variation in metabolism, organ function, and body composition. Also, the body weight. Many medications are dose proportional using mg per kg calculation to ensure appropriate drug exposure across different body sizes. Okay, next, the genetic factors. Individual genetic variation, particularly in CYP 450 enzymes, significantly ensure drug metabolism and response. Organ function. So, body organs like say, impaired renal or hepatic function necessity dosage modification to prevent drug accumulation and toxicity. So special population, pregnancy and lactation required careful consideration to ensure maternal benefit while protecting fetal and neonatal safety. So drug interaction. So concomitant medication may enhance or diminish drug effect required proactive dosage adjustment. Okay. Next, route of administration and dosing implication. So the route of administration, drug administration profoundly influence bioavailability, onset of action, required dosage. Each route present unique pharmacokinetic characteristics that must inform dosing decision. So oral, most common route, slower onset due to gastrointestinal absorption, subjects to bus pass metabolism, often requiring high doses. It's high intravenous. Rapid onset with 100% bioavailability. Requires precise dosing and careful monitoring due to immediate systemic effects. At intramuscular, moderate onset, absorption influenced by blood flow, muscle mass, bioavailability consideration are crucial. Subcutaneous, slower, sustained, ideal for modifications required gradual release into circulation. Topical, localized action with minimal systemic absorption. Lower doses requires for effective site-specific treatment. Inhalation, a direct pulmonary drug ensures delivery ensures rapid onset and targeted action for respiratory conditions. Common dosage forms: solid dosage forms, liquid dosage forms, semi-solid dosage form, injectable dosage forms. So in solid dosage forms, tablet, capsules, powders offer stability, convenience, cost effective for oral administration. Next, liquid dosage forms like syrup, suspension, and solutions provides flexible dosing, particularly beneficial for pediatric patients. So semi-solid dosage forms, ointment, cream, and gel enables topical application for dermatological and localized conditions. Sterile solutions for intravenous, intramuscular, and subcutaneous administration when rapid action or precise dosing essential. Essential posology terminology: therapeutic dose, the quantity of drug that produces the desired clinical effect without causing harm. Toxic dose, the amount that produces adverse effect or toxicity in the patient. Lethal dose, LD50, the dose causing death in 50% of the test population. Critical safety parameters. Minimum effective dose, MED, the lowest quantity that produces a measurable therapeutic response. Maximum safety dose, the high quantity that can administered without causing harmful effect. Calculating appropriate doses. Adult dosing, standard formula based on body weight. So pediatric dosing, Clark rules. Clark rule based on weight. Okay, Clark rule based on weight. Adult dose into child's weight divided by 70. Young rule, age based. Dose, adult dose into age of child divided by age of child plus 12. Understanding therapeutic index. The therapeutic index quantifies a drug safety margin by comparing the toxic dose to effective dose. Okay, toxic dose to the effective dose. Why? If the therapeutic index is high, the safety margin of the drug, okay, with a greater flexibility in dosing. Low therapeutic index means narrow safety margin. Conclusion: the pharmacist's essential role. Proper posology forms foundation of safe and effective pharmaceutical care. It encompasses meticulous calculation through patient assessment and continuous evaluation of multiple physiological and clinical factors. Precision in practice, patient-centered care, professional responsibilities. Okay.